Walk into almost any modern medical practice today, and you will see a staff stretched to the limit. They are seeing more patients and handling more administrative load than ever before. Yet when the quarterly numbers come back, net revenue is steadily leaking out of the bottom line. When practice owners look for the source of that leak, they usually audit their back office. They look at the billing and coding teams to figure out why claims are being denied. But the data suggests the source of the problem is located much earlier in the timeline. The revenue cycle begins the moment a patient's information enters your system for the first time, at the scheduling desk, days before the appointment takes place, and weeks before a single claim is drafted. According to Kodiak Solutions data, net revenue loss to final denials spiked from $38.6 billion in 2024, climbing to $48 billion in 2025. Breaking down that peak reveals a massive slice driven by intake and registration errors, causing 1 in 10 denied claims. Up to 65% of these denied claims are never reworked and are eventually written off. These permanent losses represent a front-end registration failure that the billing department simply cannot fix after the fact. The reason this happens is structural. Mid-cycle work, the tedious, repetitive task of verifying eligibility and entering patient demographics, falls into a dead zone between the front desk and the billing department. It almost never gets its own dedicated headcount. Instead, the work is pushed onto medical assistants and front office receptionists. Medical Group Management Association data shows that front office support staff suffer a 40% turnover rate. This turnover creates a costly staffing spiral. You rush a hire through training, hit a 40% turnover rate, and incur a $12,000 exit cost while downstream errors multiply. As this loop shatters, data shows wages for these roles surged 39.1% since 2015. Put a front desk employee in a chair, hand them a ringing phone, put a line of patients in front of them, and then ask them to handle complex pre-registration data entry. The pre-registration work will almost always be pushed to tomorrow. In a landscape of 40% turnover and rising wages, a shared focus model for pre-registration creates an administrative burden that high-performing practices are no longer willing to carry. High-performing practices resolve this overwhelming burden by completely severing the complex pre-registration duties away from the front desk reception. They adopt a specialized model, turning to companies like Staffingly to handle their intake workflow. Instead of treating touchless pre-registration as an afterthought, Staffingly treats it as a dedicated, sole discipline. To maintain strict quality control, these are not generalist offshore workers. They are credentialed specialists. They hold certifications from the American Academy of Professional Coders and the American Health Information Management Association, the same standard you would expect from your highest-performing in-house billers. The practice gets the same specialist or team of specialists assigned to them every single day. This provides a level of consistency that stops the exhausting retraining loop common in traditional staffing. True revenue cycle control requires taking mid-cycle data entry out of a chaotic lobby and putting it into the hands of certified specialists who do nothing else. Operationally, the Staffingly team integrates directly into your existing electronic medical record system. Whether you use Epic, Athena, or eClinicalWorks, the specialists operate natively inside your environment, avoiding clunky screen shares and lag-heavy workarounds. Deployment is frictionless. EMR access is established within 48 hours, and the pipeline is live by day 14. With dedicated bandwidth, intake becomes a 3-point verification map. The team verifies eligibility at scheduling, 48 hours prior to the appointment, and again before check-in. Staffingly augments this human expertise with AI tools. Smart routing algorithms instantly identify complex payer rules and send that specific file to the correct specialist, while automated audits scan for minute data errors before a file moves forward. Every step of this process occurs within biometric secure facilities, featuring strict clean desk policies and full SOC 2 Type 2 compliance from day one. Combining native EMR access with AI-augmented, credentialed oversight seals the mid-cycle pipeline. Intake errors are neutralized before a claim ever exists. On the left side, an in-house employee costs $55,000 to $75,000 per year, weighed down by payroll and turnover overhead. On the right side, the Staffingly arbitrage delivers the same credentialed expertise for $399 per week. The heavy burden of benefits is removed. This model operates month to month. There are no long-term contracts binding the practice. You can scale your coverage up during busy seasons or replace any team member within 48 hours. Because the accuracy rate climbs immediately, practices using this specific model see measurable ROI within 60 days. Initial claim rejections drop, and the number of days a claim sits in accounts receivable shrinks. Touchless pre-registration requires specialized discipline. If your practice is losing revenue in the space between scheduling an appointment and submitting a claim, closing that mid-cycle gap is the most urgent operational priority you have.